So thanks, colleagues, and thank you so much for joining us today. We're here to hear from a number of colleagues who have been involved in the assessing and building digital literacy skills among health workers. It's a study that took place in Papua New Guinea. We'll have a couple of colleagues representing us from the UNICEF Papua New Guinea team. They'll be talking about how the use of mSupply has been used to strengthen vaccine supply chain and the COVID-19 response in Papua New Guinea. You'll be hearing from a number of speakers today. I'll have them introduce themselves in just a second before we go into the main presentation. But we have with us today Nana Ahuja, who's been instrumental in putting a lot of this work together and really in bringing things together and bringing the digital assessment tools to both Papua New Guinea and helping us roll this out across the world. We'll also hear from Garba, who's there with us in Papua New Guinea, UNICEF Papua New Guinea office, coming live from Port Moresby, I believe. And then lastly, we'll have Ida or Goshka, I hope I got that right, Haida, telling us more about the development of the digital literacy tool itself. But I think with that, I'll pass it on to our panelists. Maybe if Nina, you could kick us off just with a quick introduction. Over to you.
Thanks, Ben, and hi, everyone. My name is Nina Ahuja, and I work at UNICEF HQ on the Digital Health and Information Systems Unit. As Ben mentioned, we've been working together to kick off this digital literacy project in PNG. I'm very happy to be here with all of you today to share this great work. Garba, over to you.
Thank you very much, Nana and colleagues. My name is Garba Safiano. I'm here in Port Moresby, Papua New Guinea, in the UNICEF office, and I work as a health specialist. And working with the team, we're looking at digital health as a opportunity or innovation to improve health outcomes throughout PNG, especially looking at the peculiarities of the country where we work. It's a pleasure to be part of the team.
Hello, everyone. Oh, sorry. Go ahead, Paula. Can't see you.
Hello, everyone. Paula Kongwa is my name. I'm the health officer working with UNICEF PNG. This is a great opportunity to share with you all our work in PNG to help our children. Over.
Hello, everyone. My name is Aida Orgolska. Thank you, Ben. You were very close. I worked with a stellar team of UNICEF HQ and PNG to put together the digital literacy assessment toolkit during October 2022, and I'm really grateful and thankful that we are able to share some of the results of that work with everybody that has come to this session today. Thank you.
Okay, I think it's Ben. You want to say a word or two, or we should proceed? Excellent. Okay, so I think it's let's start from home. We want to start from Port Moresby, and I would like Paula to take us through some of the introductory part, and then subsequently we come in. Paula, over to you.
Okay, thank you, Gaba. I'll start with the introduction. So our presentation will follow as we have seen. So the first part is to introduce PNG and talk about the state of health that we are in. Next slide. So this is Papua New Guinea and PNG for short. It is a small island country north of Australia, for those of you who have not seen. And we have a population of 7.6 million. 87% of this population live in very rural, remote areas, very difficult to access. Our capital city is Port Moresby, and the landmass is 465,000 km. We have 22 provincial governments or provinces or states, as you may call in other parts of the world. We have 96 districts and 325 local LFGs, and all of those do have healthcare systems. So most of our people live below the poverty line, so almost 2 million people, because of the rural, like I said, 87% of these people live in the rural areas, depend largely on subsistence farming, so harvesting for the day, planting, gardening, and just eating off the land. So that's why we have high rate of poverty as well. And we have challenges with literacy, because the country has more than 800 different languages, and each of those languages also we have tribes that goes along with it. So it's very complex, diverse, and difficult to reach as well. Our human index, we are not doing very well, so it's 153 and of course 159 for. So most of these things are telling us that we're not performing well as we should. We have received our independence in 1975, so working towards to improve and see where we can reach our goals to. Next slide, please. So overview of the current healthcare situation in my country. PNG is not an ideal place for any woman to do the normal things that we do in life, like giving birth to a child. It's very risky. In PNG, it's more risky, that 80 times more likely to die than a woman in Australia, which is 20 minutes by airplane away from us. Each year, 5,000 babies die in the first month of life, and 700 or so children, 7,000 or so children die and are not able to reach their 5th birthday. So these are the challenges that we do have. 2 out of 3 newborns die. 10% of all these babies, they suffer from low birth weight, and 43% of our children are even stunted. And all of these current indicators that we are seeing very, very unacceptable. Next slide, please. So the challenges which lead and also contribute to the mortality rates that I have just shared is limited formal economic and economic downturn. So PNG, as we have said, 1/3 of the land is occupied by 70% of the population, and it's all subsistence farming. We are privileged to have a very good weather throughout the year, so we produce food and eat daily harvest, so it's all subsistence farming, and the consequences of it is that. Natural disasters, either it is caused by human or infrastructure or all the other natural ones. We also have challenges with petty crimes and sexual violence, land disputes, tribal fights, as you may understand, with the 800 different languages, different tribes. Those are challenges that we also experience. Corruption is also a huge problem. We score 29 out of 100 in the 2017 corruption perceptions index. So that is also a problem that leads to some of these challenges with our health indicators. Next.
Yes.
Yeah. Next. So challenges and opportunities for the health system. There are multiple challenges to improving access to health services and their efficiency. So we have fragmented data, the quality and sharing of this is all very challenging. Poor availability of basic drugs and equipment, healthcare workers' capacity and training, cash flow issues for service delivery. Our routine immunization coverage is still low, and we also have a weak HMIS and availability and functionality of CCE. So the transition from paper to a digital HMIS will help to decentralize data entry and also helping with the reporting rates. Efforts should be made to digitalize all inventory, supply chain management, and patient records, at least to see where we are so we can base our performance on what it should be and see what we can do to address the challenges with data that I mentioned, which are faces of women and children.
So thank you, Paula. Thank you very much for giving us that very detailed background of the health situation of PNG. I want to take us through very quickly how UNICEF and other partners are working in PNG to introduce digital health innovations across our work at different levels to be able to support achievement of results for women and children. PNG as has been described, is a country that's very vast, very diverse, islands and lowlands and highlands. Particularly, this is the topography of the country, but when it comes to digital connectivity, it's that's not very great. Only 15% of the population have access to electricity, for example, and 87% of the population live in rural areas. When you travel throughout PNG, you will understand that it requires a lot of innovation, persistence, hard work to be able to penetrate and reach every child across the country. 87% of the population live within the coverage of a mobile system. However, less than 1/3 of the population have access to mobile services across. It is estimated that we do have about 1 million people that have access to internet or that are subscribers of internet in the country. However, this 1 million people primarily live in cities. If you recall, I've mentioned that about 87% of the population live in rural areas and do not have access to these services as they should. So within this context and within this background, UNICEF, in order to improve child and newborn indices across the country, introduced with funding from our donors, introduced a project that is aimed at strengthening the logistic management system for the entire country. And as you can imagine, because of the weak HMI system that has been described, because of the lack of human resource capacity, there are a lot of wastages in the system. Indices have not been achieved and all of that. So the goal of the project was to strengthen government's capacity to be able to manage the COVID-19 pandemic. I know that in the last 2 years, all of us have been affected by the pandemic, but we are particularly more affected in PNG. With our topography, with our weak health systems, it was critical that we have a system that will enable us to reach as many people as possible. It is within this background that we had introduced this project, which is mainly to strengthen the logistic management capacity in the country, building capacity of the healthcare workers that we have, no matter how limited, to ensure that the COVID-19 vaccines that we are distributing and we're giving people is of high quality, it reaches everywhere as it should, and that we're able to go beyond the paper-based systems that are not very efficient. So in terms of scope, we had targeted and we reached about 300 health facilities in 9 provinces. These 9 provinces have a population of approximately 1.8, 1.9 million people. Our estimation is that we would reach directly more than 1,000 healthcare workers, but indirectly reach about 1.5 million people with this intervention. The intervention has mainly broadly 2 components. One component is the cold chain equipment that will improve and ensure that all health facilities that provide routine immunization have a functional cold chain equipment. Plus, those cold chain equipment are linked to remote temperature monitoring devices that can monitor the temperatures of those equipment, not only for COVID-19 vaccines, but for the entire EPI system, or all the routine vaccines that we use for to immunize children. We do have a system strengthening component of the support, which is looking at the building the capacity of the national government and the provincial governments to be able to have a logistic management system that can monitor vaccines across different levels. So this is what we implemented in PNG, especially in the last 2 years, but focusing especially in 2021, 2022 at the height of the pandemic. It was critical because, as you know, only 6% of the population of PNG have got access to the vaccine. So we need to be very innovative. We need to be very creative in terms of reaching as many people as possible. These are the provinces, or these are the locations of the project. They were in 9 provinces located mainly in the highlands and some in the islands. So we were in Leh, were in National Capital District, and the central provinces all were covered. All of the green areas are the areas of the project, 9 of them. So the system is essentially built around a software application called the mSupply. Mobile, there's a DEX version of that. Health workers are trained when it's used. And to achieve this, we trained 1,000 healthcare workers across the 9 provinces, including directors of primary healthcare at different levels. This application is put on a tablet, and we ensured that each health facility had a tablet. The tablets are configured and also linked to remote temperature monitoring devices. So in these 300 sites, we had 500 cold chain equipment that are functional, and all of these 500 cold chain equipment are linked to the device. So in summary, is that all of the vaccines that are supplied from the national level to the provincial level to the health facilities are tracked in real time. And we're able to monitor the quality of those vaccines through ensuring that the temperature systems in these cold chain equipment are functional. The system is linked to a dashboard which we review on regular basis for each site. Linked to that is also an application that we had put on the tablet. This application is called Moodle. It is loaded in all of the 300 tablets. This app allows us to be able to remotely train as many health workers as possible. Recall that I've mentioned that access is a problem. 87% of the population live in places that are very difficult to reach. You need to go by boat, or you need to fly. So to be able to reach as many health workers as possible, all of our devices were loaded with this application. This application allows us to provide digital literacy, especially addressing misinformation around the use of it. Also provide COVID-19 training, and in the height of the pandemic, there were a lot of misconception, misinformation, which we needed to address, and this allowed us to be able to do that very quickly. We also had content that clearly explained how to use the mSupply application itself, because most of our healthcare workers are not that literate when the digital literacy in the country we quickly realized was very low. So I will stop here and give my colleague Ida the opportunity to give us the detail of how the digital assessment was done across the country, and then she'll take it off from me. Over to you, Ida.
Okay, thank you very much, Garba, and thank you, Paula, for setting the context of this initiative. Whenever we speak of the access and the use of digital technology, there are usually, although we often talk of digital literacy, there are different stages or different ways in which anyone accesses digital technology, and that's we speak of digital skills, so that ability to actually be able to use the digital technology. We speak of digital literacy, which is essentially the ability to purposefully use digital technology. And then we speak of digital fluency, which is essentially the ability to create something new with digital technology. In next slide, please. In putting the assessment together, I think there's, yes, thank you. In putting the assessment together, we wanted to see what actually existed in terms of assessing those three levels of access and use of digital technology. So at the time of the assessment, there was no formal research on those levels for healthcare workers, but in general there was no such formal research. As Garba was mentioning, there is modest communication technology available in the country, with most subscribers primarily relying on prepaid GSM services. There is a limited clarity on the standardized inventory of skills for existing healthcare workers, especially when we think in terms of what Paula was mentioning, which is basically the electronic health knowledge and information management system. There is the rollout of the mSupply that Garba talked about, and throughout that, there have been gaps that have been identified in information and digital literacy. Now, there is, however, there is some limited research primarily done from GSMA. If you could just stay with that slide, please. Can you please go back to the slide? There is, however, some limited research from GSMA that shows pronounced gender gaps in access and use of digital technology. According to that research, although it might sound dated, it's what we have available. Less than 20% of women own a SIM card, and 96% of those women cite affordability as an issue. As well, 47% of women versus 35% of men lack knowledge on how to use mobile financial services. Now, there have been efforts to increase those kinds of capacities. I can mention the GSMA initiative of 2015, on which there was a toolkit on mobile skills prepared. Now, all of these considerations were central to the assessment of the instrument we created. So, on the next slide, there will be a summary of how assessments are done. Next slide, please. Next slide. Next. Thank you. Thank you. So, in doing assessments, what our review of the literature showed that there have been good efforts to conceptually determine what to assess, and we commonly came across the term digital literacy, in which digital skills and fluency were folded. There are two key documents that we used, or two key assessment tools that we actually depended on when we put together the assessment. There was first the DIGCOM 2.0 of 2015, which had 5 competency areas, and then UNESCO in 2018 improved on that by adding 2 other competency areas, and those are all listed on this slide. Most of the digital assessment tools available, including these, make an assumption that they are administered online, that there is some basic digital literacy skill and literacy of the people that are assessed, and there is continuous and steady internet availability when we are doing this assessment. So how did we use this particular tool for our assessment? Next slide, please. So the assessment for health workers in PNG was conceptualized as a 3-part assessment, considering what we found from the literature review. The first one was a self-reflection questionnaire that was completed before the health workers actually started the assessment. There was an on-the-spot assessment through enumerators who were randomly positioned among the health workers. And then at the end, there was a self-evaluation of performance, asking participants to evaluate their performance on each of the tasks completed during the assessment. And this, again, was a 2-part self-evaluation that made use of the paper and pencil fill-out survey and the focus group discussion. Next slide, please. So the tool itself had 5 competency areas. It had the fundamentals of the hardware and software. It had information and data literacy, communication and collaboration, digital content creation, and career-related competencies. Safety competence was assessed as a list of survey items. Problem solving was that is primarily concerned to digital fluency, was not assessed due to the assumption that knowledge and skills on digital technology were basic. This presentation has the links to the fundamental to all the competency areas that were assessed. So on that note, I'll just leave it to my colleague Nena to speak about the actual assessment. Thank you.
Garba, if you can go to the next slide.
Okay.
Thanks. So we started this work in PNG back at the end of summer in August, where we actually held a 2-day digital literacy workshop where we got about 100 health workers in the same room to attend a 2-day workshop on digital literacy, getting them to complete the assessment that Ada just shared, and then getting them comfortable with the Moodle platform to then access the digital literacy course content. So you'll see here on the slide the breakdown of what the workshop looked like. We divided the health workers into 2 groups of 50, 2 days with the first group of 50 health workers and the second 2 days with the other group of 50 health workers. After we got them in the room, we split off the time up with our UNICEF social behavior change colleagues. We didn't want to inundate the health workers with too much of digital tools for the 2 days, considering it is a digital literacy workshop and we are trying to get them comfortable with digital tools. And since they are learning a lot of new things, kind of breaking it up with digital components and then little breaks on health and other maternal child health focuses that they're working on will help the digital piece sink in a little bit better. So the first day we started off with that health social behavior change training session. And while that was occurring, the team that was hosting the workshop took the mSupply tablets that the health workers were given and got Moodle set up for them on that, where the 3 courses that Garba showed, the digital literacy course, the mSupply refresher training, and the COVID-19 vaccine training, were loaded onto the Moodle instance on the tablets and got that all ready for the health workers. After the health workers finished their training session, we gathered back together in the same room and introduced them to what they were doing there today. Why digital health? Why are we asking them to build their digital literacy tools? What are the goals of the workshop? What are the pros and cons of using digital tools in their work? After a quick lunch break, then the second half of the day, we divided the 50 health workers into 2 groups again. Half of them did the digital literacy assessment that Ada just presented on, and the other half did another maternal child health training. We spent almost 3 hours on the assessment. As Ada shared, the first part was a self-assessment questionnaire where they filled that out and gave us an idea of how they are currently using digital tools in their life, if they do have digital tools. So that included the mSupply tablets, but also their own personal tools, cell phones, simple phones versus smartphones, if they have any tablets, computers, etc. And we asked them specifically about their personal life usage as well as their work usage, where we found there were some who had access to computers at their health facilities and were much more advanced as opposed to others who would use their own personal devices and cell phones to Google things and on the job. And the second part of the assessment was the performance piece that Ida was talking about. So we had them actually complete activities using their personal devices and the mSupply tablets, and then mark on a piece of paper whether they're able to complete that activity or needed assistance with it with the facilitators that were at the workshop, or are not able to complete it at all. The challenge here was that many didn't want to actually complete the activities. They just wanted to say that they can do it, but we wanted to physically see, because the quality of the self-report data versus actually physically doing the action and reporting on it would be a little bit more accurate. And then the first day then ended with some summary and reflections from the health workers. Day 2 was flipped. We had the second group who had not done the assessment complete the assessment. And the first group had already completed the assessment, did the maternal child health training. And again, we spent the first half of the day focusing on that. After a quick lunch break, we then came together. All 50 health workers were trained on the Moodle platform. So as I said, Moodle had already been loaded onto their mSupply tablets. So they were opening up Moodle, and we had a live demonstration walkthrough of how to actually use the application that is already available on their tablets, how to navigate through the 3 courses, how to watch the videos or look at the pictures that are part of the courses, how to download the content from Moodle so they can access the content offline, completing the quizzes, etc. So really a thorough training on how to use the Moodle app so there's no challenges and access to the course content. And there was a pretty wide Q&A session for that as well to ensure that every person could access everything that they needed. Some people were sharing the tablets. So for those health workers, we had to do a little bit more of a deeper discussion of how to share a Moodle app together, because we want to track each health worker individually on their course content progress. So how to navigate between the different accounts and make sure that the tablet can be shared among multiple people was also a part of the Moodle training. After that Moodle training was completed, we asked volunteers to participate in the focus group discussion, which was part of the digital literacy assessment. Like I said, they're volunteers, so no one was coerced or forced to participate in the focus group discussion, but the idea was to get some qualitative data around their digital literacy and the tools that they use in their everyday life that will supplement what we have already collected from the first two parts of the digital literacy assessment. There were many volunteers for the focus group discussion, surprisingly, and people were very, very happy and open to speak about their experiences, and many had very good things to say about mSupply, and they were very happy that we were there and giving them these tools that they wish that they had already, and wanted to continue to learn, not only digitally, but also in other components of their job to help the PNG community. While the volunteers were completing the focus group discussions, there was an opportunity for the health workers who did not want to participate in those discussions to do an mSupply refresher training with the mSupply team that was there as part of the workshop. And that completed the 2-day digital literacy workshop and what the breakdown was like. Next slide, Garba. So you'll see here, there are pictures from the actual workshop. You'll see everyone's on their phones, or they'll have pieces of paper in front of them. Those papers were the digital literacy assessment that we're completing. Something that surprised us was actually how long the assessment took. We were expecting it to go a little bit faster and had originally in the agenda allocated less time for it. However, people were very forthcoming and wanted to give all the details about their usage. They really were trying very hard for the performance piece of it. Once they figured out that they actually did have to do all of the things that we were asking them, such as send an email or take a selfie and send it to your friend, etc. They really took the time to try and complete it, and didn't want to just mark, I can't do it. They wanted to attempt. And we had to kind of tell them that it's okay to say that you don't know how to do this. We're trying to capture those baseline levels so we can improve the digital literacy course content and make sure we're giving you content to build your skills on things that you don't know how to do. So reminding them of those things allowed them to keep moving on, but they really, really would like to try and wanted to do the best they possibly could. And then as you can see, they were very collaborative as well. The bottom right picture was during the Moodle training session. They're working together and figuring out how can we use Moodle? How can we go through the course content? And there were, as you can expect, lots of requests for more and more course content for the remote health worker training piece. Digital literacy, the COVID-19 vaccine was all very exciting to them, but I think we came away with a list of about 20 other health-related topics that they would love to see on the Moodle application. So it was very, very successful, the two-day workshops that we did with each 50 group of participants. We're really excited to have us there and build these skills that are crucial for their work now. So I'll hand it over back to Garba.
Thank you, Nana, for that very detailed description of the digital literacy assessment, which gave us a huge insight into some of the opportunities that we do have as a country to be able to have digital technology or use digital technology to improve health outcomes in the country. So going forward, maybe it's a good opportunity now to share with you some of the results of the work we've done, especially around building capacity for the use of mSupply and some of the findings and interventions from the digital assessment that has just been described. In almost 278 health facilities have had new cold chain equipment installed, and they're using remote temperature monitoring devices to ensure the quality of vaccines inside this cold chain equipment. Of critical importance is the fact that despite the lack of human resource capacity across the entire country, we're able to train over 1,000 healthcare workers. 430 of those are males, about 448 are females, and this is mainly building their capacity on not only to be able to use mSupply, but also to be able to use the Moodle application to access training content. We think this is critical, and this is some of the work we want to carry on forward in the next couple of years. I'm showing this to give us an a quick view of how the dashboard looks like. This is showing us the number of sites that are active. Those are the 250. And we're able to see of those number of sites that are active, how many have synchronized their devices in the last 1 week. So just through looking at the dashboard, we'll be able to know which facility is active or have challenges. Like we've mentioned, electricity is a challenge. The use of the application is also a challenge. So this is something we need to be building and rebuilding or upscaling from time to time. So with this, we're able to walk through the Provincial Health Authority to be able to reach those facilities that have challenges. This is a snapshot of East New Britain. East New Britain is one of the provinces. You obviously have to fly to get there from Mosby because it's one of the islands. They have 28 health facilities in the whole of the province. Of the 28 health facilities, all of them are providing immunization services to cover the population of about 500,000 people in the province. As of when this was taken about 2 days ago, only about 5 facilities have not synchronized their devices. I think this is one of our actually shining provinces in terms of adoption of digital technology to improve the system. So we're very proud of East New Britain because of what they are doing. We've learned some lessons, both in terms of the use of the mSupply as well as the digital assessment we did, but not only from the workshop, the conduct of the assessment itself and the engagement of the health workers. One of which is the fact that digital literacy is still a challenge in PNG. It is very clear that a lot of our health workers are new. They do have telephones, quite all right, but internet penetrability is low. Use of those smart telephones is not very common, so it's making it very difficult for people to access. Electricity is a problem. Sometimes you have to give solar chargers, and some of those solar chargers in the highlands where you don't have a lot of sun is also a problem. You need to be very smart in terms of the choice of the chargers and power backups. Otherwise, it takes several days. If you give a solar charger and it takes a week to charge a tablet, it becomes a huge challenge. Training is extremely expensive in the country because you have to fly, you have to use boats, you have to charter choppers and so on and so forth. So getting to reach those health workers that are in rural areas and how to reach settlement is also very expensive. So this is the context with which we operate, and this is some of the learnings we've learned over the last 1 year. We need because of the lack of capacity at the national level. Then it means that we need to start from below up and top down. We need to build capacity at the national level, simultaneously build capacity at the lower level as well. If digital literacy is to be improved significantly, if we're to use that as an opportunity to improve health outcomes. Within all of that space is the fact that we do have opportunities. There are opportunities that we could use digital health to improve health outcomes in PNG, some of which I have highlighted here on my slide. Because of the widespread misinformation, a typical example is COVID-19. PNG has one of the lowest uptake of COVID-19 in the world. Actually, we're the best from below. Only 5.8% of target population have been vaccinated. With 2 doses. If we even make it 2 doses, even much less. And the reason is because of misinformation and the use of Facebook, use of WhatsApp. All of those are also fueling that misinformation. And we think that we can convert that into an opportunity to be able to correct those misinformation, not only for COVID-19 vaccine, but for immunization for children as a whole. The number of children that have never been immunized at all in the country is huge. Only 50% of children under 5 have had their full doses of vaccines, and which is a huge challenge. And within all of this is the fact that 50% of the vaccines that are being procured in the country is also wasted. That is why we believe that the use of digital technology would significantly improve health outcomes in PNG. We mentioned that population is rural. 87% of the population live in rural areas, have no access to training opportunities at all, because those training opportunities are expensive. We believe that the use of the Moodle application on the mSupply tablets is a huge opportunity. It's actually a game changer for health workers to be trained across the country. There's a wide spread enthusiasm and show of acceptance in terms of using that technology going forward. We know that we do have, right now, we have about 98% of our culture equipment functional. Those are linked to remote temperature monitoring devices. Therefore, building capacity to maintaining those and to them functionally or functioning optimally is a huge opportunity for us. There's also a big opportunity in the sense that we can use the existing work that we have started to expand it beyond COVID-19 to include all the routine immunization vaccines, but as well as all the maternal and newborn, all the primary healthcare supplies. So using one stone to be able to strengthen the logistic management system for primary healthcare. PNG has over 3,500 health facilities in the, as their major structure for providing health services at the lower levels. Most of these primary healthcare centers are not functional, they are closed. They are closed for so many reasons: human resource capacity, lack of supplies, and so on and so forth. We believe that the application of digital technology, use of mSupply, real-time monitoring will help PNG to be able to restructure, redefine its primary healthcare architecture, and to be able to provide those important PSCs services at different levels. We think that the investment required to do this is not much. It's just additional planning, additional capacity building, allocation of appropriate resources. I think that is possible. Is this sustainable in the long term? We think that the use of digital technology in PNG will be a game changer. We think it's sustainable. We think it's how the country should go. To achieve SDG 3 for PNG, we believe that it needs to build digital literacy capacity. We need to be able to use digital tools. We need to expand the existing platforms so that as many people as possible can be reached. That is the only way PNG can make progress towards achieving universal health coverage, towards reaching all the 87% of its population. And that's one of the mechanisms it will use to achieve SDG 3. Thank you very much for your attention. I think we're running out of time. We have 10 more minutes. We're happy to take questions. Over to the team, Ben, Ida, and Naina, if you have additional points to make. Over.
Thanks, colleagues. Yeah, look, wonderful to hear some of the details and amazing work that the team in PNG has been undertaking. Equally, Paula, I've probably got a question for you. I think some of what you presented were quite sobering in terms of the level of digital maturity in the country. You mentioned that over 80% of the population are not currently registered. They don't have an identity. I think these kind of things are quite foundational in terms of digital infrastructure for delivering not just health services, but services generally. At the same time, the Papua New Guinea government, particularly the Department of Information Communication Technologies, and clearly your collaborations with the National Department of Health, making great inroads. And we're all watching closely the new digital transformation policy and how that's being implemented. So it's great to hear how this is hitting the road for healthcare workers in the country. And Paula, I've got a question for you on that. Given this, I guess, complex environment, this nascent digital environment, you've now been working with frontline health workers through this project and beyond. What do you see is the most immediate and perhaps appropriate needs of frontline health workers in Papua New Guinea when it comes to using digital tools. So Paula, could you tell us a little bit about what you think are the next steps? Where and what investments would you like to see for the healthcare workers of PNG in 2023 and beyond? Over to you, Paula.
Thank you, Ben. From the experience of the work that we have just done this year, we would like to continue. We have seen great participation, desire, and also the willingness to learn. Me being a health worker in the rural areas before I came to UNICEF, I've realized that the capacity building that we would like to provide for our healthcare workers is very costly. And it really hurts me because I know that there are limited resources that the health workers should have on the ground. They don't. And I try to make a decision. Should I invest these dollars in capacity building because they need the capacity to do? Or do I need to invest in the resources that they need to work with after they take the training? So by looking at the health workers using this Moodle application, putting all the content of the capacity building activity that we try to do in person in hotels and everywhere, it would be the best investment. And that's what I would like to see happening, so that every health worker, regardless of wherever they are in their isolated communities, can be able to see the updated knowledge, how to manage postpartum hemorrhage, for example, or care for the newborn baby. They can do it there then as they see the information. Dr. Gaba, you want to add some?
I'll just quickly add to one point to what Paula has mentioned in terms of what are the immediate steps needed. Yes, excellent point, Paula. But I think in addition, because of the lack of digital literacy among healthcare workers, I think one of the immediate steps or action we would like to see is obviously to deepen and expand this assessment, to also expand the capacity we're building across so that we reach as many health workers as possible. Ben, as you may know, within the healthcare system for PNG, there are more than 10,000 vacancies. So many of our health facilities are only one or two staff. So even the healthcare workers are not many. So and the digital literacy within those very few healthcare workers is so low. Then I think one of the immediate steps or action that may be required, obviously, is to build that capacity within the very small number of health workers that we have. The fact that we have very low number of health workers is even more critical, that we ensure that the very little we have the appropriate skills to provide the services that they ought to provide at different levels. Over.
Yeah, thanks both. Sorry, go ahead, Paula.
Ben, anyway, when I have this opportunity, birth registration is a big challenge in the country. Our newborns should easily be registered in the delivery room, connected to the national identity registration. But just because of lack of technology and all of this that we are talking about, it's not done. So it's very sad observation that I see every day, and it's very sad. So that's one area also for support. Ben, over.
Yeah, thanks for flagging. Couldn't agree more. You know, so much begins with birth registration, including digital identity, but also legal identity. So many important factors there that come into play. I think I'm not the only one who's been tracking the recent population estimates for the country, which seem to put a lot of this into further context. We're looking at figures at about twice what we think they are. And a lot of that comes down to this lack of basic services and the gaps you mentioned, Gaba, of the 10,000 vacancies across the country. Imagine what that extends out to then in terms of ratio of population to healthcare workers, where we really are in a challenging circumstance. And it's great to hear, I think, Paula, that within that, you're still prioritizing digital. You still see this value add despite the scarcity of resources. So super encouraging to hear that this is making an impact for you. and for the healthcare workers in the country. Folks, we've got 5 minutes left. I'm going to pivot and reach out to Aida for a question. And if you could just be succinct, I want to squeeze in one more for Nina in the 5 minutes we've got left. But Aida, you spoke about the kind of breadth of the current digital literacy assessment tools, the kind of knowledge base that's out there. Could you tell me a little bit about what's different about what you've been piloting here with the PNG colleagues, and what do you see this initiative, this digital literacy assessment is contributing to that broader knowledge base and the tools that are available to us all? Over to you.
Ben, thanks for the question. There was a bit of a break in the voice, so I was not able to get all of it. But I understand that you were talking about what's different of the assessment in Papua New Guinea. As I mentioned, the most important thing is that the assessment toolkit actually was contextualized based on what we actually know of the country, and the fact that we were combining paper-based with the actual engagement with the tools was one of the things that we did differently from what I found in the literature. As I mentioned, most of the digital assessment toolkits, digital literacy assessment toolkits out there do assume the internet availability, a constant internet availability. They do assume that whoever gets assessed has some basic digital skills, which basically means getting online and knowing how to navigate that space, which probably may not have been the case for the people that we're going to assess. So that's why we had to combine those. But at the same time, what I really found very, very interesting was what Nina was talking about, the focus group component of the assessment. It's really very important that whenever we do these assessments, we are cautious to actually reflect some of the concerns that people have as they implement this assessment. So to me, those are really, those views are very, very important for how we tweak in the future the assessment toolkit. I hope that answers your question.
Sure does. Thanks, Aida. Folks, we've got 2 minutes left. I can see we've just had a question from the audience. Let me read that out. And I think Gabra and Paula, I might call on you to see if you can answer this one. The question is from Yoko. Thanks, Yoko, so much. Is there a national policy governing and planning for the future in expanding access to these digital technologies? So maybe take a stab at that. There's a couple of subparts to the question, but yeah, is there currently a national policy for governing and planning for the future in expanding digital technologies?
Yes, the answer is yes. PNG is putting a robust digital health strategy for the country. It's not necessarily for the health component alone, but in terms of it's having a digital policy for economic development. Within that policy, there's a health component. There's also a digital or e-health technical working group that's working closely with multi-stake partners to ensure that some of the digital innovations are being translated into concrete actions and interventions that can be taken in the country to improve the health environment. So the answer is yes, but it's something that is at infancy level, and we're trying to, as much as possible, to contribute to its development. Over.
Yeah, and perhaps to complement, 2022 this year saw the pass of the Digital Government Act in PNG, and this is incredibly exciting from where I sit. I work across health, across education, across all the sectors in government, but PNG is really leading in that Pacific Oceania space in terms of commitments to digitalization of government services. So absolutely amazing what's coming out of that work. Check out ict.gov digital.gov.pg, I think it is, if you want more details about the Digital Government Act and how that will then inform policies across the health space, across the education space, etc. But super exciting times in PNG. So look, we've hit time. I want to say a big thank you through to everyone on the call. It's been an absolute pleasure to have our panelists here. So let me take it away. Let me end it there. Big thank you. I hope you've enjoyed hearing a little bit more about the opportunities and the experience that our valued colleagues here have had in recent times of digital literacy. Please do reach out to the panelists, learn more about this work, how we can help scale it. So thank you, everyone. Have a great rest of your day. Thank you, True. Thank you, Big Fella. Big Fella, thank you, everyone here. And over and out from Bangkok.
Thank you.